As if Florida's long-term care industry hasn't endured enough. Now, sticker shock over just how much the pandemic has cost and why the only answer to surviving the money pit will likely put the burden on you.
Contact 5 investigator Katie LaGrone explains and shares what families of those in long-term care or thinking about it need to know right now.
As Florida's long-term care industry slowly rebounds from the pandemic, it's now on the brink of another disaster.
How dire is this situation?
This time, money.
I think if we don't see us start rebuilding our occupancy, I think you could see some challenges where we might see some facilities that close.
We're sitting here going, what are we going to do?
After a year of living and working in crisis mode, Florida's industry for the aging is in the red, with losses estimated at well over $650 million, according to leaders.
The long-term care sector has been one of the hardest hit from COVID-19 pandemic.
During a recent meeting in Tallahassee, the state's leading nursing home association made a first plea to state lawmakers for help.
Quite frankly, a workforce shortage plus COVID-19 has put us in great crisis.
Medicare and Medicaid typically pay for nursing home residents. While additional federal funding helped cover some pandemic costs, it wasn't enough to cover the historic costs of COVID testing, PPE, and staffing needed to survive the last 12 months. Couple that with vacancies that have plummeted to historic lows and have yet to rebound.
They're wondering how they're going to make it. They're running out of money.
For the state's 3,000 assisted living facilities, federal and state money isn't a natural pipeline, which means without some help, closures and rate hikes are likely.
How do you survive without passing on the cost to residents and their families?
Exactly.
It's too early to predict what rate hikes could look like, but a recent study found the average monthly cost for nursing home care in Florida was up 11% since 2016, nearly $1,000 more than the national average.
As vaccines give us hope and we hope to get back to a sense of normal, we need to make sure that our facilities can recover financially.
If you're looking for a long-term care center for you or a loved one, talk to the administrator. You might actually be able to get a deal now because centers are so desperate to fill vacancies. Katie LaGrone, WPTV News Channel 5.